The human reproductive system is a complex and essential part of human biology, responsible for reproduction and overall reproductive health. It consists of distinct structures in males and females, each playing a crucial role in sexual development, hormone production, and fertility. Understanding the male and female reproductive systems helps in maintaining health, preventing diseases, and making informed decisions about sexual and reproductive well-being. The male reproductive system is designed primarily for sperm production and delivery. The testes, also called testicles, are the primary reproductive organs in males. They are responsible for producing sperm and testosterone, the hormone that regulates male sexual characteristics such as facial hair, voice deepening, and muscle growth. The testes are located inside the scrotum, a sac that helps regulate temperature for optimal sperm production. The ideal temperature for sperm production is slightly lower than body temperature, which is why the testes are positioned outside the body. Sperm cells are produced in the seminiferous tubules within the testes. Once formed, they travel to the epididymis, a coiled tube where they mature and are stored. During ejaculation, sperm move through the vas deferens, a muscular tube that transports them toward the urethra. Along the way, sperm mix with fluids from the seminal vesicles, prostate gland, and bulbourethral glands to form semen. These fluids provide nourishment and protection to the sperm, increasing their chances of successful fertilization. The penis plays a vital role in reproduction by delivering sperm into the female reproductive tract. It contains erectile tissue that fills with blood during arousal, allowing penetration during sexual intercourse. The urethra, which runs through the penis, serves a dual function in males, carrying both urine and semen, though not simultaneously. Ejaculation is controlled by the nervous system and occurs when sperm is expelled from the body during orgasm. The female reproductive system is designed for egg production, fertilization, pregnancy, and childbirth. The primary reproductive organs in females are the ovaries, which are responsible for producing eggs, or ova, and releasing hormones such as estrogen and progesterone. These hormones regulate the menstrual cycle, influence sexual characteristics like breast development, and prepare the body for pregnancy. Each month during ovulation, one ovary releases a mature egg into the fallopian tube, where it may encounter sperm for fertilization. The fallopian tubes are thin, muscular structures that connect the ovaries to the uterus. Tiny hair-like structures called cilia help move the egg toward the uterus. If sperm are present, fertilization typically occurs in the fallopian tube. The fertilized egg, now called a zygote, begins cell division as it travels to the uterus, where it will implant into the uterine lining and develop into an embryo. The uterus is a pear-shaped organ that plays a crucial role in pregnancy. Its inner lining, called the endometrium, thickens each month in preparation for a potential pregnancy. If fertilization does not occur, the uterine lining sheds during menstruation. The cervix, the lower part of the uterus, connects to the vagina and serves as a passageway for sperm, menstrual blood, and, during childbirth, the baby. The cervix also produces mucus that changes in consistency throughout the menstrual cycle, aiding or preventing sperm movement. The vagina is a muscular canal that serves multiple functions in the female reproductive system. It allows for sexual intercourse, provides an exit for menstrual blood, and expands during childbirth to allow the baby to pass through. Its walls are lined with folds, making it flexible and capable of stretching significantly. The external part of the female reproductive system, collectively known as the vulva, includes structures such as the labia, clitoris, and vaginal opening, which play a role in protection and sexual pleasure. Hormones play a significant role in regulating both male and female reproductive systems. In males, testosterone stimulates sperm production and drives physical changes during puberty. In females, estrogen and progesterone control the menstrual cycle, ovulation, and pregnancy. The hypothalamus and pituitary gland, located in the brain, release hormones that regulate reproductive functions in both sexes. Puberty is the stage of life when reproductive organs mature, allowing individuals to develop secondary sexual characteristics and gain reproductive capabilities. In males, puberty typically begins between ages 9 and 14, leading to increased muscle mass, body hair growth, deepening of the voice, and sperm production. In females, puberty usually starts between ages 8 and 13, resulting in breast development, widening of the hips, the start of menstruation, and the maturation of eggs. These changes are driven by hormonal signals from the brain to the reproductive organs. Understanding the menstrual cycle is crucial for reproductive health. The cycle typically lasts about 28 days, but can vary. It consists of 4 phases: the menstrual phase, follicular phase, ovulation, and luteal phase. During the menstrual phase, the uterine lining sheds if pregnancy does not occur. The follicular phase involves the growth of ovarian follicles, each containing an immature egg. One dominant follicle releases an egg during ovulation, usually around day 14. The luteal phase follows, where the body prepares for pregnancy. If fertilization does not happen, hormone levels drop, leading to menstruation and the start of a new cycle. Reproductive health is essential for overall well-being. Regular checkups, hygiene practices, and safe sex methods help prevent infections and complications. Sexually transmitted infections, STIs, can affect both males and females, leading to serious health issues if left untreated. Using protection such as condoms reduces the risk of STIs and unintended pregnancies. Fertility issues can arise due to various factors, including hormonal imbalances, lifestyle choices, infections, or genetic conditions. In males, low sperm count, poor sperm motility, and blockages in the reproductive tract can impact fertility. In females, conditions such as polycystic ovary syndrome (PCOS), endometriosis, and irregular ovulation can make conception difficult. Advances in reproductive medicine, including fertility treatments like in vitro fertilization (IVF), provide options for couples facing challenges. Pregnancy begins when a fertilized egg implants into the uterine wall. The body undergoes significant changes to support fetal development. The placenta forms to provide oxygen and nutrients to the baby, while hormone levels shift to sustain pregnancy. Pregnancy lasts about 40 weeks and is divided into 3 trimesters, each marked by specific developmental milestones. Childbirth occurs through vaginal delivery or cesarean section, depending on medical circumstances. The body prepares for labor through contractions, cervical dilation, and the release of hormones that trigger delivery. Postpartum recovery involves hormonal adjustments, healing of the reproductive organs, and adapting to life with a newborn. Understanding reproductive health is vital for making informed choices about family planning, sexual health, and overall wellness. Education about the male and female reproductive systems empowers individuals to take care of their bodies, seek medical advice when needed, and make responsible decisions regarding relationships and parenthood. Whether for reproductive purposes or general well-being, maintaining reproductive health should be a priority for everyone.